Lots still to determine. Thanks, Keith. When breastfeeding isn't an option for a mother or child, people can turn to donated breast milk to feed their children. For example, donated milk will sometimes be used in hospital NICUs. As coronavirus cases continue to spread globally, there are still questions about how the virus might impact pregnant and nursing mothers. LEX 18's Sophia Millar is talking to milk banks about what safeguards are in place to help keep everyone healthy.
You can't just walk into a milk bank on any given day and donate your milk. You have to go through a rigorous screening process before they'll let you donate. And even after it's accepted, the breast milk has to go through another round of testing before it can be fed to a baby. Lauren Higdon is the director of Centered Lexington, one of 5 places in Kentucky where mothers can drop off donations for the milk bank.
It's always just been a passion to be of service in that way, and when we opened, the milk bank actually reached out to us to see if we could be a depot.
The CDC published guidelines regarding breastfeeding and the coronavirus, saying the virus hasn't been detected in breast milk, but they cannot confirm whether it can be transmitted via breast milk or not. But Freedom Kolb says when it comes to donated milk, there are measures in place to protect recipients.
What we know is our practices have safeguarded against genetically similar viruses in the past, such as SARS or MERS.
To be approved as a donor, a woman needs to first go through a health screening and blood test.
And it's essentially the same blood test that you would do if you were going to donate blood, so communicable diseases.
After approval, donors follow specific instructions to send in their milk.
When the milk comes in, it's already bagged in Ziploc bags. There are requirements that have to happen, regardless of whether we're hyperdiligent because of a virus.
From there, the breast milk is pasteurized to triple check it's safe to drink.
We always go back to all of the procedures and safeguards we go through. It really does show us that we are very well positioned in the event of a crisis like coronavirus.
Kolb says they haven't seen a decline in donations, but are asking for more women to donate their milk in case the spread of the coronavirus leads hospitals to increase demand. Some of the CDC recommendations for mothers at risk include washing their hands before they touch an infant or a breast pump, and they even recommend maybe wearing a face mask if they're going to be breastfeeding. In Lexington, Sophia Millar, LEX 18 News.